Well, breast reconstruction is the right of every woman who has had or is planning to have a mastectomy. Now, despite this, not all women facing a mastectomy are offered breast reconstruction surgery. Plastic and reconstructive surgeon Dr. Shayda Mirhaidari from Crystal Clinic Plastic Surgeons is joining us now. Hi, doctor.
Hi.
What are the benefits of breast reconstruction after a mastectomy or a lumpectomy?
So there are many benefits to having breast reconstruction surgery. And what research and studies have shown is that women that choose to proceed with breast reconstruction have decreased depression, decreased anxiety, improved self-image, self-esteem, and overall just better quality of life.
So, what are the options when it comes to breast reconstruction? What are the options available at Crystal Clinic?
We offer kind of the full gamut when it comes to breast reconstruction. If a patient's choosing to have a mastectomy, that might include what we call implant-based reconstruction or autologous reconstruction, which is basically using your own tissue, most commonly from the abdomen, sometimes the back or the thighs. In addition, we also offer something called oncoplastic surgery, which is essentially women that have lumpectomy or breast conserving surgery. It's a way that we as plastic surgeons work with the breast surgeons to kind of create a better shaped, improved contour of the breast while the breast surgeon does the oncologic portion of the surgery so that the patient is not left with, a very obvious defect when they're done.
Now, I know, especially with Crystal Clinics, you can speak very clearly on the amazing advances that have been made in breast reconstructive surgery. What are the latest advances that you see?
Well, one of the reconstruction options that we offer is something called a DIEP flap. That's DIEP. And basically what that is a form of using your own tissue from your abdomen, and where you have, some of us have excess skin from maybe having children or losing some weight. And that tissue and fat is actually transferred up to the chest to recreate a very natural breast mound. Really only about 3% of the plastic surgeons across the nation offer this surgery. So we're really happy that in our plastic practice here at Crystal Clinic, we are able to offer that for our patients.
Now, if a woman is looking for reconstructive surgery, how do you help her figure out which option is best for her?
It's really definitely not a one-size-fits-all approach. I think what we want is for patients that are faced with a breast cancer diagnosis, it's a very devastating and overwhelming thing for a patient to have happen to them. And for these women to be able to have the option of choosing or choosing not to have breast reconstruction, it does give them back some of that control. And so it's really on a case-by-case basis. We speak with the patient, talk about what their lifestyle is like, what their goals are like, and really just provide them with all the tools and resources they need to feel empowered to make the right decision for them.
Well, you can get a hold of Crystal Clinics at 330-668-4065, online, crystalplasticsurgeons.com. Thank you so much for joining us, Dr. Mirhaidari.
Thank you for having me.